I'm the Chief Executive of the Royal Liverpool University Hospital. That is the biggest teaching hospital in Cheshire and Merseyside. It has a budget of around about £520 million. We employ over 6,000 staff, and we have a range of clinical specialties, some to provide services at district level, but also we have a number of national services that we provide. And we see around about 120,000 patients through our A&E department every year. I think the thing that has impressed our team at the Royal about Restore is that they find it easy to work with the team. When there are problems, they are quickly nipped in the bud. There is a strong sense of collaboration between Restore and the staff at the Royal, so there's none of this adversarial stuff about who's to blame if something's gone wrong. It's get in there, sort the problem out, and we're massively impressed with the volumes that people are getting through. So I think all around the relationships are great, but also the output and the productivity is great. The biggest challenges facing us at the moment are dealing with the volume of patients that we're getting through and ensuring they get their treatment quickly and we can move them on to another environment quickly. Digital records help us with that, because that means we've got the information at the fingertips of our clinicians to enable them to get that treatment to patients quickly. The need for this really has been urgent for us because we're building a new Royal Liverpool University Hospital, and quite simply that won't have any space to store medical records. So a real priority for us was to digitise the record. What that means is hundreds of thousands of pages of notes having to be digitised every week, and that will run for about 5 years. So this is a massive programme, and in the end we will be looking at something around 96 million pages actually being digitised over that period of time. So it's a massive project. So it's really important for us to work with a good organisation in doing this, somebody who knows what they're doing, and it will make a fundamental difference to how we can deliver patient care. All trusts will have to embrace the digital future within the NHS. There is a national requirement to try and deliver paper-free hospital care by 2020, so all trusts will be looking at this. All trusts will also be looking eventually to electronic patient records. So I think what we're experiencing now will be a lesson for many others who have got to come in the future. But ultimately, all trusts will have to have digital records. The project is proving to be very successful. We're seeing large volumes, I think something around about 160,000 pages being done every week on the project, which is what we needed to see as we move towards the new Royal Hospital. But also I think we're seeing great working between the teams, dealing with any problems that do arise. And we're getting some very good feedback from within the hospital about the service provided, so I think it's been very successful.